For my topic of development, I chose to research the impact that childhood experiences have on the development of mental health issues in adults. Being in the nursing program, I complete a lot of mental health assessments, so I was curious to know more about how mental health issues can develop and specifically the effects that someone's childhood can have on their mental health. Also, knowing that children learn from a young age and being able to see how their actions and personalities change based on their environments, I was interested in identifying the mental changes that can occur as well. Through the research of my 2 articles, I found that an individual's experiences throughout their childhood are very important in determining their future outcomes, and specifically their mental health. The articles outline some examples of the various adverse experiences that could cause poor mental health in adulthood. These included abuse, household dysfunction, witnessing violence, parental separation, or the exposure to substance abuse, mental illness, or criminal behavior. The articles also discussed that the more adverse childhood experiences that a child has, the more likely they are to develop mental health issues in their future lives. Amongst these mental health issues, they highlighted issues like depression, anxiety, panic reactions, hallucinations, psychosis, suicide attempts, and the need for medications and treatments for mental health problems. The articles also identified the more general problems of low life satisfaction, general low mental well-being, abnormal emotional functioning, attachment difficulties, negative self-images, a lack of self-worth, feelings of incompetence, low employment, and social deprivation. One of the articles specifically addressed the impact that these experiences and toxic stress can have on a developing brain. It identified that both biological and architectural changes in the brain can occur from these adverse experiences if the child does not understand how to deal with the events. When a child in these stages of development experiences trauma or stress, the amygdala, or the emotional regulation part of the brain, hypertrophies or becomes enlarged due to an increase in the size of the cells within that particular region. The enlarged amygdala undergoes neuroplasticity, or changes the architecture of the developing brain. This change in the brain structure results in a hyperresponsive or chronically activated physiologic stress response and an increased potential for fear and anxiety. Toxic stress can also cause permanent changes in the structure and function of the brain. The changes associated with toxic stress can cause the child to have more reactive behaviors and a decreased ability to cope with stress, which can follow them into their adult lives. These articles also address the cyclic nature of this problem and that poor mental health in one generation can adversely impact the well-being of the next generation, and that individuals that grow up in adverse conditions are less able to provide optimum childhood environments for their own children. The articles also identified that the increased risk of low mental health due to childhood adverse experiences can affect the implementation and success of mental health initiatives in the general population. With regards to the prevention of the development of mental health issues in adults, the article stated the importance of understanding the factors that impede mental well-being in adults to invest effectively and efficiently in its promotion. They also addressed the importance of the prevention of mental health issues by preventing adverse childhood experiences to better the physical and mental health from childhood to old age, and in turn improve mental well-being in future generations. The articles also identified the need to intervene with these issues at that young age when children are at developmentally sensitive periods of their lives. This is when prevention, early intervention, and health promotion can produce maximum benefits. The article stated that these prevention measures could include the development of parenting skills and promoting resilience in children, as well as training midwives, health visitors, and other early years professionals to inquire about parental mental well-being and identifying and treating any possible issues. The articles also stated that at a school level, recreation therapy can help address health-related quality of life and prevent a decline in this quality of life in early and middle childhood, as well as promote well-being, productive engagement in one's life, and the realizations of one's full potential. The information that I obtained from these articles are very important in the fact that they shed light on the subject of mental health issues in our society. In knowing the impact that these experiences can have on our children and their future lives, it opens up opportunities to be proactive in how we look at mental health issues and their prevention as a society. This topic is also significant to my future career as a nurse because it has helped me to understand the childhood contributing factors to mental health issues. With this knowledge, I will be able to have a broader assessment of my patients' mental health issues and mental health histories, and hence a greater understanding of the causes, symptoms, and treatments of different mental health issues. Likewise, this topic will also help me to assess different criteria in the youth patients that I encounter, and also encourage me to use a specific dynamic and approach when caring for youth to best address their needs and prevent having a negative impact on them. Another benefit of having this knowledge is the ability to, as a healthcare provider, spread knowledge and awareness to people about the impact of childhood trauma and stress on a child later in life. This could encourage mental health to be a priority in the care of children, and if this could be implemented, then it may even prevent or limit the mental health issue experienced by adults and our society in general. And here are my references for the articles that I researched. Thank you for listening.